Welcome back to the program. It's exactly a minute past 10 p.m. You're watching Checkpoint right on KTN. Now, news that insurance companies now support generic drug use has sparked public debate on whether generic and quality be used in the same sentence. Stakeholders indicate that this will be a game changer in the overall cost of healthcare. And tonight, Dr. Wairimu Mbogo, a pharmaceutical, regulation affairs and operations expert, along with Dr. Simon Kingondu, a gynecologist and the Secretary General of the Kenya Medical Association, will help us to understand the implications. Good evening, gentlemen and lady, and welcome to the program.
Thank you.
Thank you.
So, Dr. Kingondo, let me begin with you, perhaps for the sake of our viewers. Could you just tell us the difference between this generic and the so-called original drugs?
That is actually in the realm of the pharmacist, and I would actually ask Wairimu to explain that.
Okay, so I will take up that question. So a branded medicine is medicine that is an innovator molecule. And what that means is the originator. A generic molecule comes in after the patent of the innovator has expired. So, and also we need to ensure that we clarify that the term generic can be used in two ways. So we can use the term generic molecule to define the original or the chemical name of the medicine, and also define the generic drug as a follow-up to an innovator or branded molecule.
Mm-hmm.
Yes.
Thank you very much. I think I lost you a bit of your explanation there, but I'm sure our viewers have heard loud and clear your explanation there on the differences between generic and original drugs. But let me engage Dr. Kigondu for now. We've seen some insurance companies now directing doctors to prescribe this generic drug. Will that have any sort of effect to, patients, perhaps?
Thank you very much. Doctors are trained to prescribe drugs according to their chemical name. Doctors do not prescribe drugs according to brand names. So the molecule that will treat the patient is what the doctor will prescribe. So this order by the insurance companies is superfluous because the doctor will not write a brand name. They'll use the chemical name, which is the scientific name the molecule is given to treat the patient. So for doctors, this is superfluous, but that touches more on the pharmacists who has specifically been ordered to prescribe, to dish out specific drugs which are generic. So for the doctor, this order is superfluous, but for the pharmacist, it has implications.
Yes, Dr. Wairimu, we've heard Dr. Kingondo's point of view there. He feels like, these insurance companies are giving out some sort of orders to doctors as far as prescribing drugs is concerned. Do you hold the same point of view as a pharmacist?
The first point I would want to highlight is the fact that there is a misnomer in terms of understanding that generic drugs are not quality drugs. So first of all, I want to say that we have good quality generic drugs that followed after an innovator molecule expired. So what I would want to say is that the autonomy to practice must always be left to the healthcare provider. So the decision to give either a branded molecule or a generic molecule must always be left to the person who is authorized and qualified to dispense that molecule. That autonomy is within that frame is what the pharmacist would be against from an insurance company. We also see some level of conflict of interest where this is mainly geared to a cost-related issue as opposed to a quality issue. And what are we telling the Wanjikos on the ground? The Wanjiko needs to get the best out of what is available in the market. So if the branded molecule is what is the best option for that patient at that time, that is what Wanjiko should get. If the generic is what is the better option for the patient at that time, that is what the patient should get. Yeah.
Dr. Kingondo, you've already said that you're not going to get orders or directives from insurance companies as doctors. Perhaps, don't you think that these generic drugs can be some sort of a reprieve to patients and, reduce the cost of healthcare, which is always high in this country?
Indeed, and we are very happy that the current debate is shifting away from doctors' fees to looking at healthcare costs holistically. And one of the major drivers of cost is cost of drugs. But there are other costs such as procedure fees, hospitality fees that contribute to the cost of a patient. So just to pick on one issue, which previously they have done as doctors' fees, and now they are picking on the issue of cost of drugs, and therefore giving superfluous orders to doctors, does not reduce the overall cost of care to the doctors. What we are saying is that the doctor has a duty to the patient to provide the highest quality care. And therefore, if that instruction interferes with the doctor's ability to provide the highest quality care, then the doctor will ignore it.
Dr. Kingondo, Dr. Wairimu has just mentioned the fact that there's this, belief out there that generic drugs are fake. She's saying that generic drugs are also equally good as the original ones. So as a doctor, what will stop you from administering a generic drug which is cheaper than the original, which is expensive most of the time?
Nothing will stop us from administering specific drugs. As I said, the doctor will prescribe a chemical as opposed to this instruction by the insurance companies directing you to specifically prescribe a particular name, so to speak. But the doctor's role to the patient is to give the highest quality care. So when we give...
You have no problem with the generic drug as a doctor, right?
No, we do not have a problem as long as it is treating the patient, as long as it is being verified to actually perform the task it is supposed to do.
Dr. Wairimu, let's talk about the regulatory system in this country. There are those who are saying, they fear that once these generic drugs find themselves in this country, there might be loopholes where fake drugs can also find its way into this country. So what do you think can be done to strengthen the regulatory system in this country?
First of all, I would want to define another misnomer that I have noticed. Not all generic medicines are cheaper than innovator molecules or branded molecules. Yeah. Number two, in terms of regulation, we need to see strengthening in what we call post-marketing surveillance, where the regulator, who is the Pharmacy and Poisons Board in Kenya, is able to identify probably higher risk generics than the lower risk generics. And this ensures that we are aware, both the public and the practitioners, in terms of what medicines are better than others in the market. Also, when that happens, this means that poorly or poor quality generics are removed from the system. I am not saying that there is no post-marketing surveillance. What I am saying is that we need to strengthen that area and focus more, provide bigger budgets to ensure that Kenyans are getting good quality medicines. But the decision by insurance companies to come and dictate that a pharmacist should give this medicine as opposed to this medicine and that we are not going to pay for this is misguided. It is not fair to the person who has paid for their insurance cover. They were not informed of this when they were paying for the insurance. And I believe that the decision must always be left to the professional. If they have challenges with certain institutions giving medicines in a certain way, this should be handled separately as opposed to giving a directive to a professional to what they can give the patient. Yes.
And reports indicate that about 70% of US patients use generic drugs. We're going to go to that shortly. But this question goes to both of you, that is Dr. Kingondo and Dr. Wairimu. Let me begin with you, Dr. Kingondo. And there's this notion that, generic drugs are fake. And of course, Dr. Wairimu has talked about that and explained that to us. Can you perhaps tell us why this directive is coming now from these insurance companies?
The insurance companies, the modus operandi, of course, medical insurance is a loss-making venture. So of late, we have seen a lot of tactics by insurance companies to try to lower the expenditure. One is their push to try to have doctors' fees illegally reduced. The second one is now this order, which is that you should only use generic drugs. But that is interfering with doctor's autonomy plus the patient's autonomy. As Wairimu has clearly asked, did the patient sign to use generic drugs only? Therefore...
Yes, Dr. Kingondo, away from the directive from these insurance companies, as a doctor, is there a way that you can strike a balance between the use of generic drugs and the originals? Is there a way you can do that?
The use of drugs is based on history. Doctors have prescribed, if you prescribe a drug and the patient continues getting sick, it is you who is thought of as a bad doctor. Therefore, the regulatory framework should be such that all the medications prescribed within the country do their function. So me, as a doctor, I have no power to say that this drug will work on this patient because the regulatory framework is such that these drugs have all been brought into the country. So when I prescribe the chemical name, I am hoping that on the other side, the pharmacist has given drugs that are efficacious. So that is the point.
Let me give Dr. Wairimu the last word here. You've already said that, you know, there's this belief that generic drugs, all of them are cheaper than original. You've said that that's not the case. Perhaps let's talk about the affordable healthcare. Will these generic drugs, you know, help patients there afford healthcare in this country?
The reality of the situation is that many companies are coming up with access solutions, whether they are branded or whether they're generic, in order to ensure that there is affordable healthcare in this country. The other thing is that when it comes to generic molecule versus innovator molecule prescribing, patients react differently, especially when we come to chronic conditions where a patient is using medicine like insulin. You find that a patient is only able to work with a particular type of insulin because it is a biologic product as opposed to another type of insulin. When we give such directives as a country, what are we talking, what are we saying, what are we telling the innovators, what are we telling the researchers in this country? Are we saying that now we do not want to move forward with the global trends and ensure that we get the highest standard of healthcare? So the whole affordable healthcare has to be married with quality standards, ensuring that the patients in Kenya get the best out of what is in the system, and also in a cost-effective manner. So let's remove the conversation from, are we looking at the money, or are we looking at, are we able to treat our patients or our population in the best available way and the most cost-effective way?
Dr. Wairimu Mbogu, many thanks for your input. She's a pharmaceutical regulation affairs and operations expert, as well as Dr. Simon Kingondo, who is a gynecologist. And that brings us to the end of our third part on this program, Checkpoint. But up next is Robinson Kenya. He's on standby with the very latest coming out of the entertaining world of sports. Stay with us.